you go. Oh, there is, I won't let you go. Oh, there is, I won't let you go.
The greatest gift that you've ever been given is the gift of your imagination. Your imagination is yours to be able to do anything you want with. You can place any thought in there with the awareness of I am. So your imagination is the greatest gift that you've been given. And you can put anything in there. No one can tell you what can be there or what can't be there. Einstein said imagination is greater than knowledge. The second thing is that you have to learn to live from the end. Whatever you have placed into your imagination, you have to act as if it already were your reality, independent of what anything or anyone else says. The third of these principles is the principle of, I call it assuming the feeling of the wish fulfilled. You must be able to feel it, because every time that you feel something within your body, you give a instruction to your subconscious mind. And your subconscious mind is the part of you where you do all of your living. You want to redo your subconscious mind. Now, tonight and every night for the rest of your life, I want you to take the last 5 minutes before you go off to sleep and realize that you are about to program your subconscious mind. All right? Your subconscious mind is most at home when you are unconscious, when you are asleep. If you spend the last 5 minutes of your day, which so many people do, reviewing all of the things that you don't like and all the things that didn't work out and how terrible you feel and who abused you and who was mean to you and who said this and they did this, and you're constantly doing this kind of thing with your mind. So you want to be real careful about how you program your subconscious mind. This is from the book of Job. In a dream, in a vision of the night, when deep sleep falls upon men while slumbering on their beds, then he opens the ears of men and seals their instruction. What you place into your subconscious mind as you are about to go into this deep slumber is all dependent upon what you do the last 3 or 4 or 5 minutes before you go off to sleep. You want to place into your imagination whatever you have placed into the I am that I spoke about earlier. I am well. I am content. I am peaceful. I am happy. I am prosperous. I am abundant. I am God. I am God. I am God. Because at the basic core, each and every one of us are just that. Close your eyes and just listen to this meditation. It's from the book, 3 Magic Words. Here's what I'd like you to say to yourself at night. I know that I am pure spirit, that I always have been, and that I always will be. There is inside me a place of confidence and quietness and security where all things are known and understood. This is the universal mind, God, of which I am a part, and which responds to me as I ask of it. This universal mind knows the answer to all of my problems. And even now, the answers are speeding their way to me. I needn't struggle for them. I needn't worry or strive for them. When the time comes, the answers will be there. I give my problems to the great mind of God. I let go of them, confident that the correct answers will return to me when they are needed. Through the great law of attraction, everything in life that I need for my work and fulfillment will come to me. It is not necessary that I strain about this. Only believe. For in the strength of my belief, my faith will make it so. I see the hand of divine intelligence all about me, in the flower, the tree, the brook, the meadow. I know that the intelligence that created all these things is in me and around me, and that I can call upon it for my slightest need. I know that my body is a manifestation of pure spirit, and that spirit is perfect. Therefore, my body is perfect also. I enjoy life, for each day brings a constant demonstration of the power and wonder of the universe and myself. I am confident, I am serene, I am sure. No matter what obstacle or undesirable circumstance crosses my path, I refuse to accept it, for it is nothing but illusion. There can be no obstacle or undesirable circumstance to the mind of God, which is in me, around me, and serves me now.
All right. So, good morning, everyone, to all our viewers who's watching us. Thank you so much for tuning in our program here in Naturopaths in Manila. And to all the viewers who's also tuning in with us from different parts of the world, good day and thank you very, very much. And now, I'd like to turn you over to my beautiful and gorgeous co host to greet everyone as well and to introduce our very, very special guest for this morning. Yes, Pink. Oh, yes, Pink.
Unmute myself.
I know,
Take
right?
two. Hi, Judith Alma. Hi, Philippines. Hi, world. I'm Holistic Pink. You can also call me Pink. And today is an in depth discussion about myotherapy. And it's a topic related to doctor exercise, to doctor movement, because in naturopathy, again, this is one of the seven natural doctors. And we believe that movement is also a therapy, movement is also medicine. So, yeah, it's inevitable that sometimes we got body aches, and this is one of the excuses or reasons of most people why they don't move or they just stay in bed or sit all day because they can't tolerate the pain that they have. But good thing, God has blessed us people around us to help us with this kind of pain. So for today, we have someone with us who can explain about myotherapy. So I am so excited with our guest today. He is a myotherapist. He is a movement coach and a practitioner of traditional Chinese medicine. He is also an experienced illustrator and animator, giving him an integrative approach to his practice of anatomy, art, and manual medicine through kinesiology and movement. So everyone, let's welcome Filb Tan. Hi, Phil.
Hello. Hi, everyone.
Good
Good morning.
morning, Phil. Morning.
Morning. So thank you for having me.
You're always welcome, Phil. And thank you for accepting again this invitation. So we will have a very in-depth discussion this morning about myotherapy and movement. But before we dive in to our discussion, let me just have a recap of what we had last Sunday when you um, explain to us, to all our viewers about myotherapy. You said that myotherapy is actually a muscle therapy. It talks about muscles and the main benefits of all, or the overall benefits of this therapy is actually to improve the quality and quantity of life by reducing some pain or prevention of some inflammation in our body, and to have for having a proper circulation, right? Yes, field, I think. Anyway, so going back again to his what he shared last Sunday is really thoughtful. Yes, he I think he's having a technical glitch again, or the Wi-Fi connection. But yeah, going back to the recap, he
Yeah.
mentioned also that he stumbled upon this therapy because of his personal experience, right? Yes, you're back now on the
Sorry, Wi-Fi
screen.
is free.
Yeah, so I was telling that you stumble upon this therapy because of your own experience. You yourself experienced this
Yeah.
healing benefits of this therapy because you had, when you're high school, you had a sciatica and you were not able to walk for about 6 months, and this is where um, you got into this treatment, and from there the rest is history, that you are now a therapist of this practice. You know what I would want to comment on this is, I guess it added more power and results that you bring to your patients because you yourself experience the main benefits of this therapy, apart from, of course, immersing yourself by being surrounded with your great mentors. You experience firsthand the power of this therapy, this myotherapy, that I guess for me, it's my just personal take when you were sharing with that. It's just like paying forward to everyone how, because you became practitioner and the therapist itself of this therapy. So that's a very, very wonderful sharing that you given us last Sunday, and a very powerful um, insights about this therapy. So thank you again, Field, for doing that to all our viewers, to every one of us here in this show. And yes, I'd like to start again with the first question, that how myotherapy works really and how it differs from other therapies. Can you help us understand this?
All right. So, at least just a disclaimer. Pertaining to the myotherapy that we do in St. Luke's, complementary medicine. Our myotherapy, basically pertains to the muscle. So we are, myotherapy is defined as the assessment and rehabilitation treatment of musculoskeletal conditions. So in our practice, we would also include treating the causes and the root of disorders, which means we don't just treat the musculoskeletal condition. We don't just do trigger point therapies or trigger point massage. We would also try to assess what we can with joints, the spine, joints, even lifestyle behavior, diet, and movement. So, unlike other therapies, I think some other forms of myotherapy, they focus only primarily on the muscles itself. So they would do some trigger point or myofascial releases. Same with other forms of manual therapy. They would probably only focus on joints or the bones. So what we try to do is we try to get the holistic picture, and more often than not, especially recently since I'm a practitioner of Chinese medicine, we use lifestyle behaviors, even tongue and pulse diagnosis, to get a better picture of the patient's actual condition. So yeah.
Wow. So I'm a bit curious now about when you're saying this, not about the therapy itself, but isn't it that when a patient goes to you, it's like, apart from doing such things like this therapy, myotherapy, you are integrating a lot of whole thing already, like the traditional Chinese medicine, where you're saying that you're really assessing from the root cause, especially when the patient has a condition. So this is you only, your practice. Are you saying that others, they have the kind of way, but you personally, when you do this with your patient, is really very holistic approach already? Apart from the myotherapy, you are integrating other forms of practices that you think will benefit your patient, right? Is that what you're trying to say right now, Pil?
Yes, because if we look at just the body as matter, and we don't, or we neglect the energetic components of it, you don't necessarily see the whole picture. So sometimes, more often than not, nowadays when I see clients or patients, I kind of assess what their behavior has been for a week to a month, or even way before that for new clients, because sometimes some musculoskeletal conditions are triggered by food. It can be triggered by emotions. It can be triggered by lifestyle behaviors, and it's easy to be manipulating, adjusting a patient, once a week, and then they come back weekly for several sessions, but you're not necessarily addressing the root or the cause of why they're in that state, and you're not necessarily helping. It's more like what some people pertain to as sick care. So if you're really in the healthcare profession, I try to address why their health is deviated from the health, or the path. So that's what we try to do in Chinese medicine.
Very good. Yes, Pink, do you have any other question for Phil?
Yeah, I have another question here. I absolutely agree to what you said, no, Phil, that we cannot neglect the other aspects of our being. So for the next question, should I come to my treatment if I am unwell, or what do I need to know before my myotherapy session, or what should I expect in an initial appointment?
Um, for most of our clientele, and even referrals, or even the patients who come to us in St. Luke's, we don't necessarily have indications to see us for myotherapy. So we have some people who are just desk jockeys, and people who are glued to their desks all day, and whether they're corporate executives or just people who are students, they actually come if they have any form of body pain, any form of discomfort. Now, in terms of what to expect, I think I like to set the bar very low. It's kind of like a massage that's more comprehensive, and we try to assess why and what is going on. So that's I would say the scope of our myotherapy practice. Occasionally, we have athletes who have sprains, some clients who can't walk with disc bulges, even sometimes disc bulge, nerve impingement, shoulder impingements, even dislocations. Occasionally, we get that in the clinic. Now, it just depends on how severe it is before. When we assess if it's within our scope to help. So I've seen some people not in the clinic where I've had an acquaintance who fell somewhere, and he, I won't say popped his back or anything, but we had to treat him or help him out so that he can walk again, and that's a very common thing. So it ultimately depends what and why they would come for treatment.
Okay,
Can I
Phil,
just offer,
yeah, go ahead, Pink. You have a follow-up questions.
what if I just wanted to try the treatment for relaxation? Can I also do that?
Yes. Bulk. I think bulk of the people who become our repeat customers are people who come there for the relaxation and the wellness component of it. It's not necessarily for addressing or fixing or resolving a chronic condition, but we also have some who are addressing chronic conditions.
Oh, okay. That led me now to my question actually, because I want to know if a person when goes to you or a patient, how many sessions do they really experience the benefits of this? I mean, of course, as an expert and a therapist, you'll be the one to determine depending on the condition, right? And second, yeah, like for example, a patient does not really experiencing any form of severe pain, but just really merely to experience these benefits. And then could this be a kind of so-called maintenance for them? Like for example, an athlete. I have a boy who's a footballer. He's 13 years old. If I want him to I want him to experience this. Can this be part of his so-called maintenance, because I put him in a program actually that will because he's a footballer and he really plays a lot and competes, I want him to have a program that will support his joints, his muscles. So can this be kind of thing to someone also, that it doesn't have to have a merely severe condition, but a form of maintenance to the body? Would that be healthy in a way for someone?
Um, the general answer is yes, but I don't want to give a blanket statement and say how many sessions because currently I have some clients who are pro athletes. So I have had a pro athlete basketball player who comes from maintenance. But at the end of the day, I was telling him we can't necessarily reverse the amount of input of trauma that you do from your sport. So what we're only doing is we're resolving symptoms. And if you want to work that way, that's also fine with me. And at the same time, I've had some multi-sport athletes, triathletes who also become my clients. And I tell them straightforward, we can be adjusting the soft tissues, even the hard tissues. Once in a while, we can be treating them. But then at the end of the day, we need a stronger input to treat you in the sense that if you're, for example, if you're an athlete who runs for 2-3 hours a day, or at least trains for 2-3 hours a day, if your hips and your knees and even your ankles are not designed or even not conditioned for that amount of trauma, then coming in for a 30-minute or an hour session of acupuncture or myotherapy wouldn't be enough for 5 days a week of 3-hour training. So then it's just really a band-aid solution. So for those kind of athletes, I actually tell them that the condition to actually remedy it, you actually need movement training and movement conditioning, which is you need to train and you need to use therapy and training at the same time to reverse the effects, resolve, and condition the joints to handle the trauma. So when you're asking about how many sessions, that depends on how much input. I've had some clients and patients who pulled their backs. So this pulled their backs, meaning they just suddenly hurt it. They have sharp pain on their disc and they couldn't walk properly. Occasionally, if we use some acupuncture and myotherapy at the same time, sometimes in 1 or 2 sessions they can walk. But I've also seen someone who came to me probably more than 6 sessions and couldn't really help him. We had to refer him through surgery. So that depends on the state of your health ultimately.
Correct. All right. Thank you for that. Yes, Pink.
Yeah, so we're talking about techniques here. As a myotherapist or a manual therapist, what are the techniques do you use to, of course, you've already mentioned some of the techniques. So do you have any other techniques that you're using in your clinic?
Names aside and like all these things, we're using a combination of like stretching, trigger point therapies, acupressure. Sometimes I've also used Swedish massage techniques, thigh massage, shiatsu. I have done some chiropractic manipulation techniques that I've learned from osteopathic manipulation training, spinal manipulation. We have joint mobilization. And there are times that at the end of the day, we just put them in yoga poses or even calisthenic stretches that they need to be doing while assisted. So if you're asking, at the end of the day, what I try doing is try to get them off the table as soon as possible by putting them into more movement patterns that they need to be doing regularly. Because ultimately, that's what's going to be fixing them, not the soft therapy.
Okay. I see. So, Filb, when this treatment is performing, I'm just really curious about this. Does it
Okay,
hurt?
thank you for that. No, it's very it's good to know that you're using techniques.
Okay, now let me. Sorry about this thing, but we always mute. That's why. Anyway, I was saying to Phil that is it really hurts when you do this or when you perform this kind of treatment? How is it? What is the feeling? Does the patient would really feel anything? Because when I was watching some of your videos when you're doing this, like I heard some cracking. So, what is this thing that really you're doing to a patient? So, does it really hurt? And then is it also okay for the children to try this kind of therapy and also for some adults like geriatric to be direct? So can you explain this to us?
Yes, what I said, I think in the last session, the youngest patient that I had or client I had is I think 4, and the oldest I've seen is probably 91. And
Mm,
that depends on what technique we use for the individual. And in terms of how painful it is, it also depends. So some people are very sensitive to pain, and for me, I'd like to address why. So most of the time, if you have somebody who's very sensitive to pain, there's a lot of inflammation in the system, or their nerves are very, very sensitive. And then I would look into why. What's their landscape? What's their condition like? Are they rested enough? How's their nourishment? Usually, and this is a theory, like to say, yeah, it's my theory and hypothesis that in Philippines we have a lot of what we call dampness in Chinese medicine in our diet, which is a diet that causes a lot of inflammation and phlegm formation in the system, which in Tagalog would be manas, right? So
mm,
your average person consumes a lot of sugar and a lot of dairy, a lot of processed meat, and a lot of refined flour, including bread. And because they have such diet, they become very, very sensitive to any kind of pressure on their skin. And that's the reason why locally, if you ask a lot of massage therapists, there are two kinds of clients that they'd either prefer the very soft Swedish type massage with oil, which is gliding because they're very sensitive to pressure, or the other, which would be the people who are very stiff, tough, and tense, who prefer a lot of deep tissue. So with regards to that, I would do a Chinese medicine assessment by checking their pulse, tongue, and even a palpation test. Um, Based on that, you can tell what the tolerance of the patient is, and then we would design, or I would recommend, okay, if you're very sensitive to touch, if you notice, like, when I'm pressing you and you feel a bit manas, or there's like a inflammation, or there's even like I'd like to say it's a sugar mark, where when you press the skin and then you lift your finger off, there's like a white patch or a yellow patch of
mm,
fluid. I would say that it's not the amount of pressure we're doing. Sometimes it's the amount of waste that you're consuming. So I always recommend that you have to fix your diet, because at the end of the day, most of the conditions that you have are actually caused by the food or the lack of sleep thereof. So yeah.
correct. Yes, Pink. Do you have any questions? All right. So we're having some technical glitch again here and lag time to each one of us. Yeah. So anyway, I'm that will that's a very good information you provided again, Phil, that I really like the way you're saying that diet is the main thing also, that the culprit also of the condition that we are experiencing to our body, if we're not being so aware about it, of what we are eating, can also really, if there will be always an effect that will manifest in our physical body. And it's a very good thing that at your own practice, when dealing with your patients, you're really including all of this. It's a very holistic way of approaching to your patient, and that's a very good thing that we can have that here in our country. We have that kind of thing, that it's not only a merely a practice of myotherapy, but it's an integration of all the natural treatment that you can perform and provide to your patient. And that's a very nice thing to know that we have that here. So that leads me again to my another questions that who can really see a myotherapist? I mean, yeah, you've answered already that you've catered actually from children to a geriatric, but is there's a something that a person should really know when the time that they need to meet up or see a myotherapist? Is that there's something that me, for example, or others that see a sign in our body that okay, I need to see this kind of therapist. So, any advice that you can give to all of us, Phil?
I would say like for any form of manual therapy, the if you're feeling any kind of restriction in the body, if you're feeling any kind of tension, tightness, or even any kind of discomfort on the musculoskeletal level, it would be best to kind of already see somebody who can recommend any form of treatment. And sometimes some of the doctors we have in the clinic, so our acupuncturists in the clinic, who some people have tension headaches and they see the doctor and they'd say, hey, your tension headaches come from your neck, and they would refer them to me for my therapy. Or some athletes who they've had some kind of myotherapy, which is more of the sports massage deep tissue release, but then they feel like every time they get a deep tissue massage or myotherapy for other practitioners, they feel like it's binubugbog, right? They're really
Okay.
trying to squeeze things out. So then we would say maybe that's not necessarily what you need, and you need more the Banat kind, which is the fascial stretch that we do for them. So I think it would be nice for somebody to have high, I would say, a huge amount of body awareness to know what you need. So occasionally, even me myself, I would know if I start consuming a lot of sugar, my neck gets stiff, and I would say that I need somebody to free up the restriction for me, which I would go to either a therapist who knows how to cue movement, or condition some joints, or I would go into an acupuncturist to kind of flush out a lot of the toxins. So
Correct.
that's how I would deal with it.
Okay. Yes, I think Pink will ask.
Okay, so hi, I'm nagbalag talaga sa akin.
Okay, go ahead,
I'm
Pink.
sorry for that.
Okay.
I'm sorry, Phil.
It's okay.
Okay. Hi guys, am I clear enough now?
Yeah, but you're coming too
All right.
slow.
So, if you're saying about body awareness, so can you give us tips about what if I'm not sure? Uh, what if I'm not really sure? Too slow
Sorry.
now?
Like, I think it lagged or it chopped up.
Yeah, you're not coming
Okay
clear.
na?
Really, Pink. Can you say again your question? We don't understand. There's something really have to do with your connection.
Okay. Actually, I'm not yet done with my question. Okay, so we're talking about body awareness here. So can you give us tips on how to, like have if what if I'm not really sure who to see? Can you help me or a patient know where to go if he's really not sure with
Um,
who to see if he's not really sure with who can help him, who can help her.
well, with our
Okay.
practice generally, yes, I heard it. So with our practice generally, well, whenever somebody has any kind of discomfort, pain, or even conditions, and this goes to a realm of even conditions such as insomnia, anxiety, feeling lethargic, chronic fatigue, and recently even some people who are experiencing a lot of mental health issues. whether they see a natural, not naturopath, or a practitioner of any kind of natural medicine, actually, we can already start addressing any kind of condition. So it depends on what framework they follow. When I say that, I know some people who follow functional medicine, and when they see somebody who's experiencing chronic fatigue, they would look into the diet. For us in Chinese medicine, we're gonna look into what causes their deficiency in yin, which is either food, or whether it's food or sleep. And for you guys, I'm sure that you'd be able to also recommend what the cause of discomfort or pain and condition would be. So I would recommend for anyone who's experiencing anything, you can consult with any kind of, for the lack of a better term, healing practitioner. So they would be able to help out.
Okay. So it's like really that you're saying that it depends really on the patient what their goal and what they want to achieve and experience in the form of treatment. So there's a lot. That's very true. That there's a lot of available things that we can now have access. Our people just need to become aware about it, right? So one form it could be a myotherapy treatment, other or functional medicine or some traditional Chinese. The beauty of this is all this is a natural. It's within the umbrella of natural framework that it's always good to try so that our body sometimes or most of the time our body needs first to try this kind of treatment so that we know what will really work for us, right?
Yes, I would just to add to that. I think that a very important thing here in terms of how much natural healing can help is in Chinese medicine we have something called a sub health. It's what one of my mentors, Doc Kit, would always say, that before it becomes a disease, if you are in the spectrum of health, and then outside the spectrum of health you have the condition called sub health. This is where things are not yet quantifiable in terms of test results. They don't come out in MRIs, they don't come out in blood tests. This is the area of sub-health where, as much as possible, when you're feeling something, you'd want to consult a natural health practitioner for that before it becomes a disease. So a classic example is like insomnia. Before it becomes something that leads to that, symptoms, insomnia, anxiety, all of these, they might actually be underlying symptoms of a disease that's developing, for the lack of a better term. But it would be nice to consult somebody who already can guide them, or at least show them another way to deal with it instead of
Correct.
just letting the disease harbor.
Correct.
So, yeah.
Yes, that's right. So yes, it's really better that what do you call this finding really what the form of condition they are really manifesting, so that also they will be much aware or in line to kind of therapy that they are using. Yeah. So I guess Pink has another question.
Yes. What can you recommend? Is it better to go to you, or which is better to go to you with to have a referral before I go to you, or to go to the doctor first before I go to you?
That ultimately depends, because I've had some referrals from doc or Chinese medicine doctors who are actually medical doctors in the clinic. I've had a lot of referrals from them, and they would tell me what the specific conditions are, whether they're stroke patients, cancer survivors, or even sometimes just athletes who have an acute injury. But I've also had the bulk of clients who are referrals by word of mouth, who they don't necessarily need a referral to see me. It's just as if they come in with no indication, or they just have a condition that's underlying. So if you're asking what kind of process it is, it's usually they just contact me if they have anything, and I see
Yeah.
if I can help. But sometimes I'm very direct nowadays with who I see, and if it's something that I can remedy. So it's like I have a lot of clients with frozen shoulder, and with frozen shoulder, I'm very direct that I tell them it takes a long time to deal with frozen shoulder, and before I see somebody with frozen shoulder and keeping them on quote unquote maintenance therapies, I tell them that I'd rather find out what caused the frozen shoulder and what your behavior is before we address that. So those are things that I would recommend. So it's a better way to kind of filter out whether that relationship is going to be a healing relationship or just a transactional therapy.
Very good. Yes. Okay, so that's a. I like that. You're very direct to the patient. You firsthand, you would really or immediately tell them if this is something going to be a therapy that needs a complete participation of a patient, and if you cannot really, you're just going to really say that um, try another therapy or another ways to deal with it. It's like, really your niche. Yeah, you don't also waste your time and energy, and that's a very good thing for someone like, like us therapies, and as naturopaths also. Yeah, that's very true. We should also know our boundaries. We cannot address everything. Yeah, and then it's good that we're very honest and direct to people who come to us. And it's you're saying that if it's a transactional or a relationship thing that you're going to have with your patient, it's a very very important thing, actually, process of healing also of a person, that the therapist and the patient will have a full commitment on their what they're trying to achieve, or the goal that they want to have. Yeah, so for the next question, I'd like to know how long does this this therapy take to work really. I know you mentioned a while ago it's always depending on the severity or the condition of the patient, but more or less, can you give our viewers parang viewpoint only, when they come to you or to the myotherapist, will they really experience firsthand already the benefits of this, or it will somehow take longer? So there are other therapies that on the first hand they will really experience thing already. So regardless of the condition or situation that they're bringing up to their healthcare professionals.
Um, so when we say how long does it take to work, it depends on again, ultimately I don't want to give a blanket statement because I've seen some people who are quote unquote healthy in terms of the fitness standard, where they follow a very salad and veggie smoothie diet, and then they do yoga every day. But then when you look at the condition of their muscles, it's very undernourished. So when they come for therapy, they come once and then they'll have to come again in a week because nothing. That's only half the equation. The passive therapy is half the equation. So what I would say is you can feel some immediate effects in one session. So
Oh,
usually for my therapy, and I'm just using my therapy as a label, but
yes.
whether we do a spinal manipulation or even a cervical manipulation, I've seen some patients where they immediately feel relief, instant relief. And that depends on what they do for that change or that input to sustain. So if you pull your back and you have a sharp acute pain on your lower back, or even if you have a stiff neck, in a session you'd feel relief. Some of them it's good after a session and they need follow up for probably, I'd like to say, once every 2 weeks until it's good, and then they're fine. But then if the input, for example, I've had a client who said there's this pain in this area, and then drinks a lot of alcohol after the session. After a
Correct.
week, it's really bad, and I can't necessarily tell them that it's not going to work while you're constantly consuming alcohol. So that's something that I'm not comfortable answering the blanket statement of how long it works, because uh, I've seen a cancer survivor, cancer patient, who it took less than 5 sessions to for her to completely regain access of her frozen shoulder. And I've seen another one who all the way until 3 years her frozen shoulder is not getting better. So that is a very chicken egg question. Yeah.
Correct. Yeah, I agree to what you just said. It's really depending always in the situation, but for some, I think also the full commitment and the openness of the patient is actually very very vital to this kind of therapy field, no? Because of course as a therapist you can only do so much, and then when they get out of the table and then go on with their daily activities, depending of the kind of lifestyle they really practice, and then that's also they will depend of that kind of thing, will also how long will it last, this kind of benefits will stay in their body. Yeah, like for example diet is very very vital to this kind of practice, the lifestyle we have, and enough sleep, proper hydration, all of that comes to that in places, right?
Definitely. I think that's where on upon the first time I see a client or a patient, I'm very upfront with you. This is the things that I you'd want to do. If you're not able to follow them, then at least we're in an understanding that that's already my recommendation. So
Mm,
if somebody's unable to follow them, then it becomes harder for somebody to help you if you're not willing to help yourself. So
correct. Yes, I agree. It's up to a person also how much you want to be well, how much you want to put out to your process of your healing and for your complete and permanent healing. Yeah, yeah. So that's um very good to know. Pink, do you have anything to say or another for the last question? Do you have? Yes, Pink. I don't think he's really getting us. She's really getting us in real time. There's always a lot. I hope it's okay to all our viewers. This is very raw because this happened really when we do our live program. But nevertheless, Phil, I'd like you to invite all our viewers where they can reach you. Do you conduct online classes
Yeah, I
right
have one last question. But I agree, no, that healing talaga is
I'm talking. Anyway, it's okay. Go ahead. Go ahead, Pink. He has a lot. She has another question field, so I hope it's
yeah,
okay with
sure,
you.
it's okay.
Go ahead, Pink. Go ahead. No, it's okay, Pink. She said, sorry about this. Go ahead. Yes, Pink. You feel anything.
ngayon lang pumasok. Kanina pa ako nagsasalita.
And
Go
now
ahead.
you're in real time, I think.
Okay, now. Yeah, it's true that
I I don't think she's in our real time right now, but let me take over this. Okay, let me just take over this. Okay, Phil, I'd like you to invite all our viewers. Do you
real
conduct?
time na ako.
Let me do it now.
Right.
Okay, let me do it now. Okay, so let me please do you conduct online classes right now with the situation that was, I mean, the pandemic situation? Do you
Yes.
provide kind of treatment online, and what are the classes you conducting also? Maybe our viewers would like to know more of this practice. So please let us know.
So currently, I think after September, I have 3 online classes left. So I conduct an animal flow class on Friday nights, and I have a flow class on Saturday afternoons, and I have a movement RX class on Sunday mornings. So the difference is animal flow is a trademark movement system that's it has its own form of set various disciplines of bodyweight practices that is merged into one fluid movement system. And the flow system or the flow class that I teach on Saturdays are multidisciplinary movements as well. And on Sundays, what we do is it's a movement training class for people with conditions from neck, shoulders, spine, and hips. So that's the main thing. So it's like a mobility class for that. So that's currently the classes that I do, and the others is I do online consultations and sometimes a lot of private consultations with clients.
Okay, so we're flashing the contact of Filb Tan. This is his number and email address also. Phil, for people that who have quite very interesting that you mentioned the animal flow. For people who have no background of this, no practice of this, super beginner can attend your online class with they make sabay with your class with this animal flow thing?
Actually, I'd like to clarify that. For people with conditions, like I've had special population, a lot of seniors who have been my clients for animal flow for a long time, and
Okay.
it's just a bit more difficult for them to participate in an online class if you have your specific condition. But then if you don't have a condition, you're able to hold or do a push-up, I would say, or put weight on your wrist, then animal flow should be fine for you. But I've also had a client where he tried animal flow once, where he had so much trouble getting on the base position that it would be something that I would ask him to conduct a private animal flow class if he wants to get the animal flow.
Okay, so yeah, so that is your contact for everyone who's watching us, and for those who's watching us that you think other people that can benefit this therapy and this practice that Phil Tan is offering. He's conducting an online class, it's an online consultation. You can reach him through his email address, and then it's flashing right now on the screen, plus his contact number. He will be very happy to accommodate your inquiries. Yeah, Phil. And
Yes.
thank you so much again, Filb Tan, for your kindness, your generosity, and your beautiful energy that sharing with all of us here in this program of Naturopaths in Manila. I'm sure a lot of viewers right now who's watching us learn again from somebody who is an expert and top caliber from this field of myotherapy plus movement, hearing from someone who's really practicing is, experience it by hand, and really up to this date doing this and form as a therapy to his patient. Thank you so much, Phil, for accepting our invitation, for giving us your big yes. So grateful to have you in our program here in Manila.
Yes. Thank you for having me.
You're welcome, Fred. So anyway, to all our viewers, I'd like also to invite our viewers to watch out this ANC conversation with Marie Lozano. I'm gonna be guesting with her show
Wow.
this Wednesday at 5:30 in the afternoon. I just get the information from their marketing that there will be a replay of this of the same day at 10 o'clock in the evening. But if you want to catch me with Marie Lozano tomorrow on at 5:30 in the afternoon in her ANC conversation show. Okay. So yes, please say something to our viewers and to our gorgeous guest here.
Ayan, sana okay na. I just wanna say that healing, okay na? Healing
Yes.
is really the result of everything that we do in our lives, you know. So no matter what therapy that we're into right now, it's really up to what's the majority that you're doing in your life that will affect really the type of life that you want. So if you're too much of doing this or too not really doing this and that, it's really a balance of everything. So for us to really have of that, to maximize the life that we have. And yeah, thank you so much, Phil, for saying yes to me. And thank you so much to all of our viewers. Thank you so much, Judith Alma, for taking over for your patience. Phil, thank you for your patience.
That's okay, my love. That
Yeah.
really happens, of course. We cannot avoid this thing. Anyway, to all our viewers, maybe I'd like a pink. Are you going to flash our next episode so that our viewers will be aware
Yeah,
what's kind
Phil.
of what episode or topic that we're gonna have for this coming week? So please go ahead, Pink.
So for next week, we're gonna have.
Oh,
Yeah. No
right.
one's.
Next week, our guest will be Dr. Rob of the chiropractor. We're going to be talking about his practice. So watch out for this coming Sunday at 3 o'clock in the afternoon for the overview of his topic, and on Tuesday for the in-depth discussion of the topic of chiropractor with Doc Rob in himself. So thank you. And to all of our viewers, see you again, and we're so happy and so grateful to always doing this to all our viewers. And thank you for continuously supporting and watching us here in Naturopaths in Manila. Again, to our viewers, have a blessed day ahead.
Yes, have a blessed week ahead, guys. Thank you, Phil. Thank you,
Thank
guys.
you.
Bye.
Thank you.